Sorry. So I posted, so she posted a Cahoots review that she had done previously as well. So we have all of that posted there for you. So any questions regarding exam two? No? Okay. All right. Everybody needs to have their cameras on, please. All right. So it's going to be chapters 10 and 11. So chapter 10 is about cultural uniqueness, sensitivity, and competence. And I will share my screen. You do have the PowerPoint available to you as well um, in the announcements. So those are there for you. But I will share my screen. All right. So again, cameras on, Tia, Natasha, Nakira. So week three, cultural uniqueness. This is going to be chapter 10 in your Success in Practical Nursing textbook. So when we look at
Okay,
culture,
so my camera not on.
who's speaking?
My
Oh,
camera.
Nakira, I'm sorry, you're on here twice. My apologies. Um, and so culture is a way of life, right? And so when we look at culture, it's learned behavior, right? It's how you grew up, but it's a total of the ever-changing knowledge, ideas, thoughts, beliefs, values, communication styles, actions, attitudes, traditions, customs, objects that a group of people possess. It also includes the standards of behavior and a set of rules to live by. And so everybody here has grown up. Oh, okay. Um, so everybody has grown up differently. We've all, depending on, if we grew up in a different country or we grew up here in this country, even different parts of the United States, right? There are different cultures that we are exposed to. So these are some of the things that help to shape us as we grow. All right. And different cultures, different beliefs. So there's different terms that we can use when it comes to culture. So when we look at cultural skills for effective nursing, so one of the first ones is our cultural competence. And so cultural competence is the continuous attempt by you as an LPN to gain the knowledge and skills that allow them to effectively provide care for clients of different cultures. And as nurses, you are going to be exposed to different cultures in your practice, right? Um, and so depending on what area of the country you live in too, or that you practice in also is going to determine the different cultures that you are exposed to. Cultural sensitivity is an awareness of different cultures. Okay. It's an awareness that not everybody has the same beliefs and values that we do. Enculturation is the process of learning your culture. A lot of people are very immersed in their culture and have a very good understanding of their culture. Others, right, they, may not have as strong a background in growing up within their culture. And then socialization is a person of one culture learns how to function in a larger culture. So an example of this would be you as a, um, new graduating nurse or new graduating LPN, right? Learning how to function in a larger culture, as in, depending on where you're working, you have to learn how to interact with other members of the healthcare team, your new clients, patients, those kinds of things. When we look at cultural universality, all persons share the same basic daily needs, right? Doesn't matter if we're male, female, or another identification. Doesn't matter your age, your economic status, your lifestyle, your religion, your country of origin, your culture. We all have the same basic daily needs. And when we think of this, think of Maslow's hierarchy of needs, right? Those lower needs are universal. So if you remember that nice little triangle, right? Those lower needs, rest, nutrition, hydration, elimination, those are all everybody's basic needs. So it doesn't matter where you're from, who you are, what color your skin is, what religion you are, we all have those same basic needs. So when we look at how do we develop cultural competence, all right? So thinking can be affected by your culture as well. So again, how we grew up, how our culture influences, right? This can affect our thinking. Our values may differ. Okay, so something that I value as part of my culture may not be something that someone else values as part of their culture, and this is something that we do need to be aware of. We also need to discover the uniqueness of the client. And this is where, when we're doing our admissions assessment, that we're incorporating, right, that incorporating that cultural assessment as part of our, our interview. What are some things that they value? What are some things that we need to incorporate into their plan of care? And how can we do that, maintaining a nice, safe, healthy environment for our clients? Some of the dangerous thinking, and we've all seen these and we've all probably experienced these at different levels. Stereotyping. So, stereotyping is an inaccurate generalization used to describe all members of a specific group without exception. Okay. And I'm sure everybody has heard, of some type of stereotyping at some point in their lives. And I'm going to use myself, I'll use a redhead as an example. I don't know if are there any other redheads on here, but right, redheads have more fun, or all blondes are dumb, right? Those are some generalizations that we have heard, right, throughout our lives. And there's others out there, but it's an inaccurate just generalization that is used. Cultural bias, that is mental learning that is never proved or questioned by the individual. The worth of everything depends on it fits the worldview of the cultural group. Okay, so that's the definition of cultural bias. Ethnocentrism, this is the attitude that one's group way of doing things is better than that of groups within different cultures. Okay, so I grew up in a very strict Polish Catholic um, culture in New York. And so the community that I lived in was largely Polish. And so if I were to say the Polish way is the best way to do things, that would be ethnocentrism, right? That is saying that, my culture's way of is doing or is better than anybody else's. Prejudice is an intolerance of another cultural group, and I'm sure that everybody understands what prejudice is and how it can be applied. And this is something that we try to avoid in life in general, but especially in healthcare. And then discrimination is withholding rights and privileges from those of another cultural group. And these, again, these are dangers that we try to avoid in life as well as in healthcare. So, some areas of cultural diversity. So, when we look at social organization, this is a big part of it. Um, Different cultures, they have different views and different styles, I guess would be an appropriate term as far as their family unit, their political views, and even their affiliated or their affiliated religions or ethnic groups, right? The family unit, we think of traditional family units. We think of like, maybe mom and dad and their children, or, I would say partners and their children, or just partners, maybe they don't have any children. But in a lot of cultures and even in, in our society here, we have a lot of extended families, right? So we may have, them living with grandparents, maybe living within the home as well, or the households. Um, there also may be families that are unrelated people that are living within a household, but they consider each other family. So the family unit is definitely different. How the family unit interacts with each other may be different based on their culture as well. Space. This is always a big one. Space is the degree of comfort when speaking or interacting with people around us. And so somebody that we're close to, maybe a family member, even children, we know children have no concept of personal space whatsoever, right? Um, but this is different for different cultures. It's even different for people, right? We know like during COVID, everybody was 6 feet apart, right? But like, you ever go somewhere? So for I'm gonna I'll use myself as an example. So a few years ago, I had to go to the doctor. I think I don't know, it was like strep throat or sinus infection or something anyway. And my doctor was not available, so I had to see another one of the providers in the office. Not a big deal. Really nice lady, but she had to be like right here. She was like so close to my face when she was talking that like you're sitting on the exam table and I kept trying to like push myself back as far as I could because she was just way too close for me. And so these are things, right, that we do have to take into consideration when we're talking with people. If we're somebody that's very more touchy-feely type of a person, we have to be aware that maybe the people that we are around or that we're conversing with are not those types of people. They may need a little bit more space. And so this is something to take into consideration. Um, and then we have biological variations across cultures. Some of these can be visible, some of these are invisible. Okay, so things like body build and body structure, hair type, eye shape, skin characteristics, those things can be, very visible. In contrast, things like nutritional variations, incidences of specific diseases. These aren't something necessarily that we can see, but we know, right, that based off of genetics, that there is an increased risk for certain diseases. So I will pose the question. When we look at specific diseases and ethnicities, what are some variations that we know exist? Come on now.
Maybe like
eye and hair color.
maybe like hypertension, I guess, is more prominent among African American men.
Absolutely. Hypertension is more prevalent among our African American population. I'll take Hispanic population, okay? Married Hispanic. I am not Hispanic, but my husband is 100%. So things like hypercholesterolemia, hypertension are and type 2 diabetes are very prevalent in his culture, right? So I need to pay attention to him when I cook and um, Um, so, these are things that are invisible to us, but, based off of cultural, these are things that we want to start screening for early, right? So that they, that we can keep them under control or try to prevent them from, exacerbations. When we look at time, okay, so this is something that we don't often think about, okay? So the concept of time. So when we look at the concept of time, time can be linear or it can be, um, on live. Okay. So meaning that, how do I explain this? Time can be present, it can be past, or it can be future oriented. Okay. So people who live in the present, they live in the moment, right? They know exactly what's going on. Give me 1 second. And so they live in the moment. Okay. So when they are finished with what they're doing here and now, then they are going to move on to the next task, right? So someone that lives in the past, they often look to like their ancestors for wisdom and guidance and value previous experiences. So history. Um, Anybody know of a culture that is more past oriented? Think of a culture that relies on its ancestors for wisdom and guidance.
Native Americans. I was about to say the same thing.
Yeah, Native American, some of your Asian cultures as well, right? They look to their ancestors. And then we have those that are future oriented. They are generally very punctual. They're very strong planners. So they're going to be more like looking to plan for things in the future. So we look at time too. How do I explain this? Like we tell you as nurses, right? We need to be very punctual. You have your specific time for classes, when you have very specific time for, clinical times, when you go start working in healthcare, right? That's another thing. You need to be on time, right? For your shifts. You can't be late. There are certain cultures, right, when it comes to appointments and times that they are not always so, they're not always punctual, they're not always on time. It's more of like a reference point than it is an actual, like, I have to be there. So, working in healthcare, right, these are some of the clients that we may have to work with. When we look at wellness and illness beliefs, those types of things, different cultures have different beliefs, obviously, in wellness and health promotion. So, for preventing illness, they may have rituals that they perform, which can be a variety of different things. They, also may incorporate some other rituals when it comes to curing illness. So when someone is sick, there may be something that, they may do to try to, cure that illness. So I will give another example. So my in-laws, my mother-in-law more so, um, very strong belief in the evil eye. And so if any of the kids got sick, she strongly believed that it was because somebody had given them the evil eye. And so there were specific rituals that she would perform when they got sick to try to rid that evil. Okay. So there's obviously a lot more, right? Different types of, um, rituals and beliefs that occur. Um, some people believe that it's an imbalance, right? So, like when we look at hot and cold, right, with some of our Asian population, trying to think of what else. My brain. But there's a variety, there's different herbs and other things, that either prevent or cure illnesses as well. With that, we have complementary and alternative medicine. And these medicines focus on assisting the body's own healing powers and restoring body balance. And you will notice, at least I've noticed, I guess, because I've been a nurse for a long time, that more and more complementary and alternative medicine is being added into healthcare practices. And there are more and more alternative medicine providers that are popping up now that can, help the body. So, think of like some of these practices or things like massage, acupuncture, acupressure is another huge one. And some even like what is it? Like they use some herbs and medicines and stuff. So there's a variety of different options out there. And even, incorporating those into the practice of illness treatment has definitely um, started to pick up. You see, more and more of these providers. Modesty. So, individuals in some cultures are embarrassed when they have to discuss certain bodily functions or allow certain body parts to be examined. We also look at hygiene practices, vary according to beliefs, their living conditions, their resources, as well as their physical characteristics. What are some We'll get that. Never mind. And then mental illness. Some cultural groups attach a stigma to mental illness and psychiatrists, but they are more accepting of like the physical issues that are going on. Other groups believe that mental illness or mental symptoms manifested are a healthy reaction to an emotional crisis. So you may, depending on what your culture is and what your beliefs are, that may affect your thoughts about getting mental health or even treating those with mental health issues. Um, so care planning. So like I said, where you live and where you are going to practice is going to determine the type of client that you are going to experience. And some cultures are more or some areas are more culturally diverse than other areas are. So, like, for example, I told you guys I lived in Virginia before moving to Texas. I was there for over 30 years. Okay. So lots of different cultures. We had a lot of African American, we had a lot of African immigrants, we had a lot of Filipinos. Trying to think of what else. There were some other Asian groups as well in the area. Um, when I was in New York, we had a large Jamaican population, a large Russian population, a large Asian population, of course, African American population, and then a lot like there's, still the Polish population that I grew up in. So each area is unique. Obviously, when I moved down here, there's a very large Hispanic population, okay? Almost wishing now that I had paid attention in high school Spanish, okay? Took 4 years of high school Spanish and still can't speak Spanish, which my husband likes to laugh at me about on the daily basis. So, um, again, it's going to depend. What do you think are some of the best ways that you can learn about a person's culture?
I think asking them
Ask
questions.
them.
Yeah.
Absolutely, ask them because is every person or is everybody in a culture going to express their culture in the same ways? Now, I see head shaking. No, absolutely, right? We aren't all going to express ourselves or practice the same, right? The same practices. Some are um I don't know what the appropriate word would be. Some are much more immersed in their culture and want to incorporate their culture as part of their daily practices. Others may have grown up in a certain culture but don't practice, the rituals and other things that are part of that culture, right? So that's where we avoid, right, that stereotyping. Just because they belong to a specific culture doesn't mean that they are completely immersed in it. So care planning for culturally diverse clients in your areas, gather data regarding activities of daily living and personal health beliefs for each client of a different culture. All right. So what are some things? Let's see. Just some examples of things that I have come across in my practice. Okay. Um, So we had a family, they brought their mother in for respite care. She was terminal, she was on hospice, so she was actively dying. And for whatever reason, the family decided that they did not want her to pass at home. So they brought her into the facility during her last couple days. Okay. They were of Middle Eastern descent, and I don't remember if I knew they were not Muslim. I do know that they were not Muslim, but I think they were like Indian anyway. Um, so like I said, she was there for hospice. She was there, to end her, her time in the facility. And so the night before I left, now I'm not even lying, okay, I went in there to do my assessment, and her respirations were at a 4. Okay, so I was like, for sure, right? Like when I come back the next night, she's gonna pass, right? She did not. When I came back in the last night, she was still respirations of 4, and she was still there. And so what I did was I asked her son, I said, is there anything that we need to do after she passes, to preserve the body? Or, some cultures you don't clean the body. Um, so I wanted to be really careful with that post-mortem care. And then the only thing that he did tell me was not to shave the body, which we generally don't do that. The only thing that we would do with a female, maybe just for dignity reasons, we would shave the face, right? Shave the facial hair if they had excessive facial hair. But I thought that was interesting, right? I was like, okay, that is something that I had never heard, not to shave the body. So I made sure that we, didn't do anything to disrespect the body. In some of your Jewish populations, right, with end of death behaviors, you don't clean the body. That is another ritual that is performed at the funeral home. Um, Another one that I thought, and I don't know if this was cultural, or I'm not sure where this actually fell in. But back early in my practice, I was still an LPN. We had an Asian family. They did not, the mother was our patient. She did not speak any English. I'm not sure. I don't know Chinese, Japanese, Thai. I don't know which specific Asian. I just remember that they were Asian. She had a diagnosis of stage 4 cancer. I don't remember where the cancer was. The reason why the story stays in my head is she did not know she had stage 4 cancer. So had come to us for therapy for some reason. I don't remember if she had a fall or what the reason why she was there with us. And the son was her power of attorney, and he made it very explicitly clear to us that he did not want his mother to know that she had a terminal diagnosis. So these are some things that you may come across, other things within different cultures, who the matriarch or who the patriarch of the family is, who's going to make the decisions. So I had another when I worked in pediatrics. They were, I think they were Muslim. The father made all of the decisions. And so even down to when, the wife would bring in the daughters for like immunizations and things. We were not, the mother could not authorize for those. Like she would have to call her husband. I would have to, I would have to speak with the husband and tell the husband like what exactly that we needed to do, why they needed the immunizations or whatever procedure it was that they needed. And then he would give us consent. So like I said, these are some things. I had a group of students in clinical one time. There was a Muslim man who did not want female caregivers. All right, so that made it a little difficult for the facility. I mean, we were just there as students and instructor, but they did not have any male CNAs on staff. And so that was something that the facility also had to look into. So you may come across a variety, and I mean, I've had other experiences, but those are the big ones that stick out, that, made me really think about how, how are we going to handle different situations, as we, are in healthcare, um, and while not infringing on anybody's rights or anybody's preferences. Other things, avoiding stereotypes. Avoid automatically applying information gained from one client of a culture to all clients of a culture. Okay, again, remember that even though somebody is part of that culture, they may not follow all of the particulars of that culture. Expect those personal variations. And that's why it's so important, again, like I said, when you are doing your admissions interview or your admissions assessment, that you are asking them very specific questions related to them, not just as a part of a larger group. Information about cultural groups might explain behavior, but not predict it. So don't make assumptions. Again, the best way that you can get to know your patients is by asking them questions. And most people are very willing and open and, going to tell you exactly what it is that they do want and that they don't want. Um, Another thing too is suspect cultural differences when a client is not following the plan of care, they refuse treatment. They also may be erroneously labeled as a problem client. All right, so this is where it's super important that you try to go and question the client about their ADLs, their wellness, and their illness beliefs. Again, we can incorporate their cultural practices into their plan of care. That is not something that we would not do. All right, as long as it's not going to infringe on the rights of others, or unless, there is a safety concern, that would be the only time that we would have to avoid the, incorporating any of their specific, desires. So specific examples of adapting plans of care for culturally diverse clients, discover the health beliefs of the individual, co-create treatment plans with the client, preserve the beliefs and practices that are helpful to the client. And then this is a big one. We want to repattern harmful practices. So what does that mean? What does it mean to repattern harmful practices?
Like still incorporate the practice, but try to modify it so that it doesn't cause harm to the patient.
Exactly. So for example, okay, so I mean, I'm going to stop sharing. So I'm going, this was a big one and I learned my lesson. Okay. I'm going to tell you, I learned my lesson. But Vicks Rub. Anybody use Vicks Vapo Rub? Can't even say it. Love Vicks. I love
Yes,
Vapo Rub. Like it's amazing. Okay. So some cultures, okay, believe in putting it in the nostrils.
that's
Okay.
me.
Well, that's what I was going to say. Not supposed to. So a repatterning of that behavior, right? Rub it onto the chest. I did do that once though. Okay. I didn't put it in my nostrils, but I put it like the two little dabs like underneath my nares. And it because I was so congested, I was like trying everything and nothing was working type of deal. And I sleep with the fan on. Okay. Um, so I put the two dabs underneath my nostrils and I went to go to sleep and I laid down in front of the fan and it was on fire. Like it was on fire. Like, I mean, it just felt like it was burning. I'm like, now I know why they say not to do that. But I was so desperate for some sort of relief. So yes, don't do that. But that would be an example. That would be an example of repatterning, right? Because like I said, there are some cultures that believe in putting it in the nostrils. And while I feel like it may be effective, but it can burn, it can cause damage. I will tell you though, for those of you that do like it, they have the Vicks little nasal stuff that you can use. and it works really good too. I do have that in case of emergencies. I don't, the last, like I said, the last time I got sick was probably, I don't know if it was COVID or the flu or some sort of combination, but I was absolutely miserable. And so I made my husband like, please go get me some of that Vicks nasal stuff so I can try to get through class and breathe all at the same time. Cause, I'm going to tell you, the struggle was absolutely real. Um, all right, so let's have some dialogue now for a few minutes. So tell me, what are what are some different cultural practices that you've come across or that you have that you would like to share, that you may come or that you've seen in healthcare?
Can you repeat that?
I'm sorry.
Can you repeat that, please?
Sure. So, has anybody come across any cultural practices, whether it's in clinical or where you're working, that you would like to share?
Oh, yeah, like new dietary restrictions.
Oh, that's a good one. Didn't think about dietary restrictions. Okay, so what are some dietary restrictions?
Can't eat blood, I guess. I don't know.
Okay, what about pork products,
Pork
right? What?
products,
Yeah.
some cultures like some medicines have pork in them. Like even you have to let the patient know you're putting it in their body.
That's a really good one. So I actually um had Jewish population, they don't eat pork, right? And when I worked in pediatrics, the polio vaccine, the injectable polio vaccine is made, I believe it's porcine. Um, and so our Jewish patients would actually go to their rabbis, and get permission to receive the polio vaccine for their children because of that reason. So these are absolutely some things that we need to pay attention. Diet is very important in a lot of cultures, and we need to make sure that we are not disrespecting them, by providing foods that, they're not going to eat, and still making sure that they are getting a well-rounded diet, right? Because we know how important nutrition is in the healing process. So that's a good one. Trying to think, there's not really other things, that wouldn't be cultural, it'd be more spiritual. So, but yeah, so again, the best way to really understand the different needs of those patients, is to ask them. Now, you can do research. I mean, there's nothing wrong with doing research. If you have you live in an area and you know what the larger percentage of the different cultures that are in your area, you can do research to get some basic information so you have an understanding of how those different cultures interact. Um, that is absolutely fine. But again, you want to avoid the stereotyping and the generalization because not everybody is going to be part of that bigger culture or, what's the word, or have all the parts of that culture within what they're caring for. Trying to think of what else. I think that'd be it. All right, so that's going to bring us into chapter 11. And chapter 11 is spiritual needs, spiritual caring, and religious differences. So very similar to culture, right? Everybody has some sort of a spiritual or a religious need. But let's go ahead and take a break, and be back at, let's do 325.
Jalecia,
My
thank
bad,
you.
y'all.
All right. All right, sorry. Amber alert. Um, all right. So talked about religion or culture. Now we are going to talk about religion and spirituality. All right. So religion and spirituality are different for everybody. Okay. Um, so give me 1 second. I'll share my screen. All right. So think about spiritual needs or spirituality and religion. Spirituality, everybody is spiritual, okay? In their own way. Spirituality is an essential part of being human. It has to do with experience, beliefs, and values that give strength and hope. And it's something that is different, okay, than religion. Religion has to do with giving form to that experience, right? And so a lot of times when we think of religion, it can be a spiritual experience that contains religious, spirituals, rituals and beliefs. But it's usually in a much more, what's the word I'm looking for? Is structured content, right? Like, when you think of religion, we think of churches or mosques or temples, right? Where we have that religious experience. Um, but spirituality is a little bit different. It's something that may not be formalized. It is something that each of us do on our own, right? And how we express that is going to be different. Having spirituality does not always mean one participates in a religion. Okay, so you can be spiritual without having a religious affiliation, all right? And you can be religious, right, as well as spiritual, all right? But they are, in essence, different. So the spiritual versus the emotional dimension. So spiritual dimension gives us insight into the meaning of life, suffering, and death. It also may include relationship to a higher power. Okay, so again, somebody can be religious, somebody can be spiritual, they can be both. Not being religious and just being spiritual doesn't necessarily mean that they don't believe in a higher power. Their thoughts about that higher power just may be different than those, within a formal religious organization. The emotional dimension or your emotional needs, these are how people respond and deal with feelings of joy, anger, sorrow, guilt, remorse, love, pain in some situations as well. And so the spiritual dimension, again, it requires the same emphasis that other daily needs receive. Okay, so when we are doing that admission assessment and we're asking them all those questions and we're asking them about their culture, we also want to ask them about their religious and their spiritual needs as well. So like you go into the emergency room, you go in, admitted into the hospital, and they are going to ask you if there's any specific religious or spirit cultural needs that need to be accommodated while you are under their care. And that is, it's your preference, whether you care to disclose that or should you want to disclose that information. So why is it important? And everybody is going to have their own version, whether you are religious, whether you are spiritual, but when we look at spiritual care, it involves helping clients to develop an awareness and maintain their inner strength, their self-awareness, life's meaning and purpose, their relationship to others, relationship to a higher power as well. And so this also goes all the way back to Florence Nightingale. She encouraged nurses to be instruments of spiritual caring in all our situations. We should avoid waiting for those crisis situations to occur, right, before we become concerned with spiritual care. And this is why we ask it on admission, right? We want to try to be respectful and incorporate as much as possible, right? Um, into their care. The Joint Commission requires that that spirituality is assessed for all clients. Okay, so doesn't necessarily provide that exact guideline, but it does say that we need to assess it. So we can, ask things like, what gives you meaning and purpose, or, what gives you strength, what gives you hope, how do you express your spirituality? What are your goals, right? So we can ask different questions. So, who needs spiritual care? So, again, individuals, a spiritual dimension is private, it's very personal. And then, like I said, all people do have a spiritual dimension, and, we have to be respectful of that. So, someone that is coming into the hospital and they're going to be hospitalized, those that are in pain, those that have a chronic or incurable disease, those who are dying. And again, our job as nurses isn't just for the clients, right? We have to work with their families. So, families who have experienced the death of a loved one will need spiritual care. Those that are facing an undesirable outcome of an illness, like an amputation, or those that have have emotionally lost control of themselves. And so basically everybody that comes through those doors that we are caring for, then we need to make sure that we are providing for spiritual care. And you'll notice that in a lot of places, most hospitals have some sort of a chapel, right? Or um, some even have like the gardens outside, and other areas within on the campus, right, where people can go to, whether for religious or for spiritual purposes. Um, I will tell you, I think the ones I saw, one of the coolest ones that I saw down here, one of the long-term care facilities down here, it's beautiful. I've never seen a facility like this before in my life, but like I said, we have a huge, very large population of Hispanics down here. And when you first walk into the long-term care facility, if you look to the right, they have a huge chapel, like huge. They have pews, like church pews in there. They have stained glass. They have like, it looks like a little mini church, honestly, is what it looks like. And not all facilities, go to that extent and, have as much as that does, but I just thought that was really interesting that they put that much time and effort into making sure that those clients in their facility have that for them should they want to go in, whether it's to, sit, pray, or, just, whatever. I'm just going to say for whatever reason. So I thought that was really cool. But we really need to be paying attention to this when our clients are coming in for care. So when we look at gathering data for spiritual issues, the first step to making sure that we are providing spiritual care is to become comfortable dealing with spiritual matters. Okay, that in a lot of cases, and some people are not comfortable working and dealing with religion and spirituality. The second step is to become aware of your own spirituality and the spirit that is the essence of you. Okay. So, just like with a lot of other things, even with the ethical aspects of nursing, one thing that really helps is for you to understand yourself and how you feel about certain things. Now, for example, like I said, I grew up a very strong Polish Catholic um, in household and community, and religion was a big part of it. I went to Catholic school my whole life, from the time I was in preschool to the time I graduated high school. It was a very big part of our lives. And for whatever reason, I sometimes still am not comfortable, praying with other people. And it's not a belief issue. It's not anything like that. It's just, I don't, for some reason, even though I went to church, twice a week and did all that, I still, to me, my religion, my spirituality to me is more private. And so I took a long time for me throughout my nursing career to be comfortable sitting and praying with patients and families. But this is something that we really do need to take into consideration. And we have to understand about ourselves, like how comfortable. Now, not everybody believes in prayer, and not everybody has, a belief in um, a higher power, right? But this is where that self-awareness is going to come into play for you. So meeting, some be able to meet the needs, the spiritual needs of clients and families, ask questions, just like when we did the cultural assessment. This is the same thing. In order to meet the needs, whether it's spiritual or religious, we need to ask questions. And that will help them to verbalize their beliefs, their fears, their concerns. We also want to show interest. And I know this is something too that, because of time constraints and other reasons, but we want to show interest. We want to show that we are interested in what they're saying. We want to listen with an understanding attitude. Be sure your body language, your effective responses reflect what you were saying. Respond naturally to spiritual concerns, just like you would if somebody was expressing a physical need, right? If they're in pain, you know, what are, something we want to be just as concerned with spiritual concerns as we are with physical concerns. Help clients face the reality of terminal illness without abandoning hope. Okay. And this is care, this isn't one of those, oh, it's going to be okay type of situations. When it comes to spirituality and religion, we want to offer, understanding. We, want to encourage them to, um, keep their practices, whether it's reading the Bible, their prayer books, their rosary beads, or, other emblems that may bring comfort to them. Allow families to participate in caregiving. And this is always a big one. We always encourage families to participate in the care of a loved one, right? This isn't something that is new. um, Depending on, what the situation is and what stage of care we are providing. It could be, helping them to the restroom. It could be, offering fluids. It could be assisting them with eating or even assisting them with reading their scripture, praying, whatever it is. But again, it's always avoiding those false reassurances, right? We don't ever do that, right? We don't want to say it's going to be okay because we do not know it is going to be okay. And when a client faces death, and this is a hard one for a lot of people, you can help, to make the remaining days meaningful by making sure that we're attending to their needs, that we are respecting their beliefs, and their practices, and approaching this, the client in a supportive and empathetic manner. Make, and I don't know if anybody as a CNA has worked with a client that has, been going through the dying process. But knowing that someone is there and feeling that presence or even feeling loved does bring peace to that person that is dying. And so, things like I don't know what we can just learn. I mean, and you should know, and I'm sure that you can learn so much from your clients of any age. And so it's also just really just taking the time and being there for your patients. So some of the interventions ask open-ended questions because we know those open-ended questions are going to give us the most response, right? We're going to get the most information by asking those open-ended questions. Make sure that you're listening actively and you're using those active listening techniques. You want to sit by the client, you want to make eye contact, you don't want to be judgmental. So you want to be completely non-judgmental of their clients as well as whatever those responses of you that they're offering you. Sorry. We don't give advice, we don't lecture, and we definitely don't try to change a person's beliefs. Okay. So that is not our job. Okay. Even if you don't have the same religious or spiritual beliefs as another person, our job is not to convince them to change religions or, change their spirituality. Again, as healthcare providers, it is about respect. Be aware of nonverbal messages from the clients as well. We also want to try to understand the client's feelings, but avoid adopting those feelings for yourself, right? So, really understanding what the difference between empathy and sympathy is. Um, and then, if clients request help with prayer, help them. And I know, like I said, this may be not a comfortable place for some people, but if they need help with prayer, help them with their prayer. If they ask you to read an excerpt of the Bible or whatever their religious book is, read it to them. If they want, to like, I'm just going to stick with Catholic because that's Catholic is what I know. If they want their rosary beads, make sure they have access to their rosary beads. If they want their St. Christopher medal, make sure they have access to their St. Christopher medal. Whatever it is, prayer shawls. Each religious group is going to have its own religious articles that may be required for them. The biggest thing is to protect those spiritual or religious articles to the best of your ability, right? Protect the Bibles, or other religious books, other, articles. We don't want to get them we don't want them damaged. We don't want them lost, because that can cause spiritual distress to that person. And so just be mindful of that. Um, the pastoral care team. So the pastoral care team is made up of ministers, of priests, rabbis, and even some of our religious women, which could be like our nuns that we see, or it could be other religious organization members, or even laypersons. So, for example, even in the Catholic Church, we do have lay people. We have, of course, we have our priests, right? And we have our bishops and cardinals and all of those, but we also have deacons, and deacons are not, they have not received the formal order as a priest, but they are lay people that have been ordained within the church and can help with some of the, church duties. Um, all of these people are educated to meet the spiritual needs in addition to religious needs in a healthcare setting. Um, and so the nurses will work with members of these teams, to help provide spiritual care. And so this is another question that's often asked upon admission, in addition to, the religious preferences, spiritual preferences. Would you like a member of the clergy to come visit you? And so that could be that a member of the pastoral care team will come and visit you in your room. If you are, like, for example, like I said, I'm going to stick with Catholic because that's what I know. Do you want to receive the sacrament? And so, they'll come around and they will, issue sacraments. So, it really just doesn't, it just depends. But the pastoral health or the pastoral care team, can help to explore fears, hopes, provide some strength. And oh, like I said, most hospitals have some sort of a pastoral care team. The family and the client as well, they can always reach out to their own spiritual leader within the community and invite that person to meet with them at the hospital. So it kind of, it really depends. And I know you guys talked about in community, right? You guys talk about the parish nurses, right? You learned about parish nurses in community. So one of the nurses that I worked with a long time ago when I worked in pediatrics, she went back, she got her master's in, trying to remember. I don't think I want to say there's like a specific title, but it's like a master's in divinity or pastoral studies, something along those lines. I don't remember exactly. And so she retired from Children's Hospital, and then she went to become a parish nurse at our local Catholic church. And she also volunteered at the hospital as well. So these are things that you see. She did it as a nurse. So she kind of understood, right, both sides of it. So regardless of their religious beliefs or even lack of religious beliefs, because again, not everybody has, religious beliefs, all clients have a spiritual self, and that is something that we need to pay attention to. They all have spiritual needs and personal spiritual practices to help them meet their needs. And again, spirituality and religion are separate, right? Religion, we think of formality, right? There's churches, there's specific rituals where spirituality could be something as, spending time in nature, going out and gardening. It could be meditation. It could be listening to music. It could be, watching, some of the spiritual shows on TV, or even movies. Breathing exercises, art. I said music, right? Walking, talking with friends, crafts, hobbies, okay? That it could be completely different for anybody. Not everybody is going to express their spiritual needs in the same way. And, you can probably attest to that. Everybody expresses them differently. Now, with the formal religions, right? Um, the religion self is the specific beliefs that individual holds in regards to a higher power, right? And so some clients choose to meet their spiritual needs, right, by belonging to a religious denomination. And a religious denomination is an organized group of people who share a philosophy that supports their particular concept of that higher power. And so, they also have, worship, experiences and other things that they believe in. An atheist is someone that does not believe that the supernatural exists, so they do not believe in God. And then you have your agnostics. Agnostics hold the belief that the existence of God can be neither proven nor disproven. Right. So it's a little bit different than atheists. They're kind of like in that middle place. We look at rituals and practices. So, different rituals and practices of a religion are stabilizing forces. So, they are a series of actions that have religious meaning. And so, they can bring the security of the past into a crisis situation. And this is where I was saying about the symbols, pictures, icons, herb packets, rosaries, statues, jewelry, other objects. These can all affirm the client's connection with a higher power. So like my grandmother always had a rosary, always. My mom was very big on the Infant of Prague. So we had Infant of Prague. We had my mom also made sure we all had St. Christopher medals. So it's a variety of different things. I don't wear my crucifix anymore. I do still have it, only because I've had it for so long. Like one of the little pieces started to break, and I didn't want it to get damaged anymore, so I took it off. So there's a variety of different things that are out there. And again, it depends on the specific religion as to what their symbols are and what they hold dear to them. And like I said, it's always super important to make sure that we are respecting that and we don't want to get it damaged or, lost or, anything like that. Um, and so, spiritual distress. There is actually a NANDA diagnosis for spiritual distress, and that can be observed in clients who are unable to practice religious rituals, or even in clients who experience a conflict between their religious and spiritual beliefs and the health regimen. So, these, are something that, we look and take into consideration. So this one, it says rape considering abortion. So this would be a spiritual um, conflict for a Catholic client. Say we had a Catholic client that had been raped and is considering an abortion, that would be spiritual distress because the Catholic faith does not allow for abortion. Okay. And so, right, that would be an area of spiritual distress for that client. But unable to practice religious rituals. Okay. So think about that, like I would say, um, my grandmother, she lived in Brooklyn until she passed away at 97. She lived in the same house that her and my grandfather bought when they first moved to Brooklyn. Um, and towards the end, it was she had her knees replaced, and so she lived in a brownstone, so it's kind of hard to describe, but regardless, to get out of her house, she either had to go upstairs and then back downstairs, or she had to come out through the basement stairs, which were real sketchy at best. Okay. And so towards the end, she did not have a way really to get out of the house. And so the 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 priest would come to her. And so the priest came to see her on Wednesdays and Sundays and would give her sacrament, so that she could still have that. But we have to be very careful, because, especially with some of the older practicing, they've been practicing their religion for many years and now they cannot have access to their practices. It can be very frustrating and very upsetting. So we do want to really make sure that we have access. And I will tell you another personal story with this. So my mom, again, very strong, when she was in hospice, one of the big things that we needed from hospice was for the priest to come and give her last rites. And so the day that she passed, I just knew that she was not going to make it through the rest of that day. And so I started to I had a little bit of my own little mental breakdown because I was like, oh my gosh, the priest has not come and given her last rites yet. So I called the priest, I called the church, and I was like, hey, really need some help. Um, and so literally, I will tell you, when hospice and dying patients is a different experience, but he came and he gave her last rites and she passed within the hour. So it was something that she definitely knew that she was waiting for, and she needed to have that before she could successfully, cross over. So we don't always think, that this is a priority, but we do have to make it a priority, to make sure that our patients are comfortable and that they're getting the services that they need. Prayer is also a spiritual practice of some individuals, whether or not they are members of an organized religion. Okay. So just because someone isn't a member of an organized religion doesn't mean that they don't pray. It helps to put them in touch with a personal higher power. It can help to decrease anxiety. It can help clients cope with illness or even with certain situations. And we can assist, like I said, If a client asks you to pray with them, pray with them. If they ask you to read an excerpt of their Bible or another religious book, go ahead and read that for them. That would mean a lot to your client. And it really just helps to build that client relationship, and show respect. Um, like I said, doesn't mean that you have to believe the same things that they believe or even practice the same way that they practice, but it just shows encouragement. We look at religions in the US and the world. And so we'll just look at the US, okay? In the United States, there are 215 distinct church traditions, which you think that's a lot, right? But we look at the breakdown here in the of the world population. We have Christians as 31.2%, Muslims as 24.1%, unaffiliated is 16%, Hindus 15.1%, and Buddhists 6.9%. In the United States, the Roman Catholic Church is the largest denomination in the US, followed by your Baptists, and then Methodists. Yeah, Baptists and then Methodists. So can you believe 200, and that's a lot, 215 distinct church traditions in the United States? That's a lot. And so again, impossible, right? To know everything about every religion. And, so it's absolutely important that we avoid, we get to know our clients and what their needs are specifically. And of course, this, just like with the culture, we want to avoid false assumptions and stereotypes. So it's a false assumption to expect that all individuals of a specific religion or belief system will behave the exact same way. Individual differences occur within every religious or belief group system, and clarify with the client the specific beliefs and practices that offer comfort to them. So again, we don't want to assume just because they fall into a specific religion that they are going to follow all of the rituals of that. So there, funny story for y'all. So, um, I was married for a year, my first marriage, a whole year. Okay. We got married at Justice of the Peace. And so when I went to go marry my husband, now we've been together for over 34, 35 years now, whatever. But I had gone to the church because in order to get remarried, you have to have your marriage annul, even though you're divorced, you have to have like this annulment procedure through the church. And so Father Joseph was a great guy. He is a great priest, and everybody loved Father Joe. So I met with Father Joe, and I told him what I was, what I wanted to have my marriage annulled so I could get remarried. Um, and, in the process of the conversation, I mentioned to Father Joe that I had, two aunts that were nuns. I have an uncle who is a bishop, and like all these like spiritual people in my family. And he looked at me and he says, "And you still didn't get married in the Catholic Church?" And I was like, "Yeah, nope, I didn't." So he kind of got me there, but so we don't all practice all of the same. And some of the beliefs that we even had as children tend to change as we get older, and people's experiences within the church also are different. And so, what one's experience, Catholics, we have, there's a lot of stuff out there, right, about things that have happened in Catholic Church. Is not gonna lie, but everybody's experience is different. I was raised in that I would think of like the peace, love, and happiness part of it, right? Where we respect each other, we love thy neighbor. It wasn't political, it wasn't all about, money and donations and things like that, where and that's just the church that I grew up in. And like I said, I do have aunts that are nuns and an uncle who's a bishop and all of those wonderful things. But that's the relationship. That's the church that we were raised in, where I've talked to other Catholics that were raised in much more strict environments and have since left the church because of those reasons. And so again, everybody's experience with religion and spirituality is different. It's individualized, and this is something that we need to really respect as we get, as we get to know our clients. And I mean, I honestly, I couldn't even tell you. Um, you know, I know a little bit about, I guess, enough about, some things that, could be helpful when it comes to different religions, but always ask. Um, I think one of the most interesting things I've ever seen was, and I still to this day, I do know I knew what it is now because I did kind of look into it, but we had a client who was Jewish, um, and she had cancer. She passed, and we knew not to do any postmortem care on the body because that is part of their, like, I don't know, like part of the death ritual or whatever it's called. Um, and so the daughter, the patient's daughter and I guess the patient's daughter and the daughter's daughter, they were both there. They came in to see her after she passed. And she came up to the nurse's station and she asked me for a pair of scissors. And I was like, oh, of course I have, I have my little bandage scissors. So I gave her my bandage scissors, and she took the bandage scissors and she took what is this? The like top of her shirt, and she cut it with the scissors. And then she did that to her daughter's shirt as well. Handed me the scissors and they just walked out. And I was like, I just sat there and I was like super confused. And this is why I say not they don't it's then there's so many difference, but our CEO, he was Jewish as well. And so he happened to come around the corner shortly after that. And I stopped him and I asked him, I was like, hey, have you ever seen this or have you ever heard of this before? Because I knew he was Jewish. And he was like, no. Um, he goes, I've never seen that or never heard of that before. And I was like, okay. So I did research it. It's just to show that they are mourning. Um, but I just thought that was interesting. And within the Jewish religion, I guess there's multiple different, sects within that. So it could have just been, a specific belief to a specific sect of that religion. But I just thought that was something that was interesting. Um, but again, it's always best to ask. I always, we always ask on admission. I always ask in very specific, like I was telling you earlier, when it comes to end of life, because we don't want to do anything that could potentially cause any spiritual distress, or be something that would be against their religion. So being very mindful of that, if you're dealing with somebody who is getting ready to transition, making sure that you know what is expected at end of life, so that we can, prepare the body appropriately, and not violate anything, in that process. So, all right, so that is um all for spirituality and religion. Does anybody have any questions on spirituality or religion or anything that we've covered today? Why are y'all so quiet today? Why? Why y'all? What's going on?
Just tired.
Has it been a long week? All right. So yeah, like I said, that is all for that. I'm going to give you guys a break and then we'll do some practice questions. So be back at 4:15. All right. So for the last few minutes of class, I have some practice questions. Um, let's see, I picked ethics, communication. I think those were the two topics that I chose. So I will share. So you can either verbalize your answer or you can put it in the chat. So give me 1 second. All right, share my screen. Make sure your cameras are on, please. Hanja, Janet, Michael, Natasha, Giselle. All right, so in question number 1, the nurse shares with the client that violation of a civil law usually results in which types of penalty? Select all that apply. So 1, monetary fine, 2, public service, replacement of property, imprisonment for more than 1 year, or monetary fine and imprisonment for less than a year.
Monetary fine?
So is number 1, 2?
Okay.
Mm.
Can it be 5 too?
Number 5. Okay. All right. So it was 1, 2, and 3. So let's see. So civil laws protect the rights of individuals within our society, and the consequences of civil law violations are damages in the forms of fines or specific performance of good work, such as public service. A monetary fine, public service, and replacement of damaged property would be examples of this. Criminal law protects society as a whole and provides punishment of crimes. So a felony is punishable by imprisonment for more than 1 year. A misdemeanor or less serious crime is punishable by payment of a fine and imprisonment for less than 1 year. All right. Another select all that apply. The nurse has just been licensed and has begun to practice in an acute healthcare facility. The nurse knows that which nursing specialties will require more specific defined standards of care and skills. So nurse midwives, nurse anesthetists, post-surgical care unit nurses, intensive care unit nurses, and respiratory disease unit nurses. Which of those would require more specific defined standards of care and skills? So somebody's
Anesthesiologist.
1, 2, and 4. I
1,
think.
2, 4.
Or yeah. No.
Very good. Yep. The nurses are responsible for meeting the same standards as other nurses practicing in similar settings. Specialized nurses, such as nurse anesthetists, ICU nurses, and certified nurse midwives, have specially defined standards of care and skills. Nurses who care for clients on med-surg units do not require these specially defined standards of care and skills. That was like a tongue twister. All right, good job. All right, another select all that applied. The nurse is aware that the Americans with Disability Act provides which rights? So again, select all that apply. 1, labels asymptomatic HIV as a disability. 2, protects the privacy of individuals with HIV. 3, provides employment to persons with disabilities. 4, prohibits discrimination in employment and public services. Or 5, allows healthcare workers to refuse to care for a client with a mental health disability.
Uh,
So,
3 and 4, definitely.
excuse me, 3 and 4. Okay,
2, 3, and 4.
2
Oh,
as well.
oh,
Yeah.
Okay. All right. So answers are 1, 2, and 4. So we got 1. All right, let's see. So the Americans with Disabilities Act protects the rights of people with physical or mental disabilities. It prohibits discrimination and ensures for persons with disabilities equal opportunities in employment, state and local government services, public accommodations, commercial facilities, and transportation. It does not guarantee employment. Asymptomatic HIV constitutes a disability, and the ADA protects the privacy of individuals with HIV. It also states that healthcare workers cannot discriminate against HIV positive employees or clients, sorry. All right, next one. The nurse is caring for a client who has refused to take oral medication. The nurse tells the client that the nurse will hold the client down and give the medication by injection if the client doesn't take the medication or the oral medication. The nurse then takes the client's bathrobe so that the client will have to remain in the room. Which intentional tort has this nurse committed?
1
1
assault.
and 3.
False
Okay.
imprisonment.
All right. So yes, absolutely. The nurse has assaulted or threatened the client with an injection. The nurse did not touch the client without consent, so there was no battery. The nurse forced the client to stay in the room, which is false imprisonment, but the nurse did not invade the client's privacy, nor did the nurse defame published false statements about the client's character. Good job. Oh my gosh, they just know all the select all that applies here. All right. The nurse is aware that which criteria are necessary for a situation to be classified as malpractice. Select all that apply. Excuse me. The nurse disliked the client. The client sustained an injury. The nurse owed a duty to the client. The nurse did not carry out a duty to the client, or the client's injury was caused by a nurse's failure to carry out a duty.
Definitely 4 and
So
5.
4 and 5.
Okay, so definitely 4 and 5.
2.
2.
And 2, okay. All right. So any other ones?
Number
2,
1.
3. Number 1,
3.
3. Okay. So yes, 2, 3, 4, and 5. When nursing care falls below a standard of care, nursing malpractice results. Certain criteria are necessary to establish nursing malpractice. 1, the nurse owed a duty to the client. 2, the nurse did not carry out that duty. 3, the client was injured. And 4, the nurse's failure to carry out the duty caused the injury. It does not matter if the nurse liked or disliked the client. So remember those 4 things, right? To show negligence, right? All right. Which are the best ways for the nurse to avoid malpractice? Select all that apply. Bringing gifts to each client, perform interventions in a timely manner, provide the same care to each and every client, document assessments and procedures completed, and know current nursing literature in their area of practice. So what is the best way to avoid malpractice?
Number 4.
2, 3, 4.
4.
2, 3, and 4?
Yeah.
All right.
I think 5.
And 5? Okay.
No, don't put
No
it.
five?
Um,
No five. Okay. It is 2, 4, and 5.
Ooh.
All right. So the nurse can avoid malpractice by developing a caring rapport. Okay, so we don't bring gifts, but we definitely want to build that rapport with the client. Okay, that's always a big part of it. To avoid a lawsuit, avoid malpractice is build that rapport with your client. And by documenting assessments, interventions, and evaluations completely and in a timely manner. Nurses need to also know current nursing literature in their area of practice. Okay. And we don't provide the same care to each and every client, right? We provide a standard of care to each and every client, right? But we individualize that client care.
that's a tricky one right there.
Yep. It is. Yep.
I
So
like treating everybody fairly, but they mean like you doing the same exact thing for every. Come on.
exactly. Yep. So be mindful. That's why I like to do these practice questions. Be mindful of that wording, right? Because same care to each and every client, right? We know it's not the same care, right? It's the same level of care, right? But not the same care. All right. The nurse is aware that criminal offenses would have which characteristics as opposed to civil offenses? So, one, it is offensive to society in general. Two, it is detrimental to society as a whole. Three, it involves an issue against an individual. Four, it involves offenses such as robbery, murder, and assault. Or five, it will result in punishment issued for the purpose of deterring future crimes.
3 and 4.
This is tricky. So, criminal offenses have which
3 and 4.
characteristics? Three and four.
Oh, I
It's
was gonna
not,
say everything but three.
No, it's not. It's
Yeah,
not.
five.
Wait, no,
Five.
no, no, no. Hold
oh,
on.
I think it's everything but three.
No, it says, wait a minute.
Five is one of the
This is
answer.
where the criminal, okay, criminal offenses will have which care. Okay, so yeah, 4 is a criminal offense, and 5 is a criminal offense. Yeah, I think it's just 4 and 4.
Just 4 and 5.
isn't it about society if it's criminal? Like I thought civil was against individuals and society is criminal.
Okay.
Everything but
Like
three.
it's
So,
both those. Like if it's offensive, I think detrimental to
okay. So this
like murder
one.
is detrimental, not offensive. So
Uh, all right.
Yeah,
All right. Here we go. I may hit submit. It is also offensive.
wow.
So good job, Charles. Charles got it. Charles got it. Good job, Charles. He said he kept saying everything but three. So you got it, dude. um, so the characteristics of a criminal law involve conduct that is offensive to society in general, detrimental to society as a whole, and that involves public offenses such as robbery, murder, and assault. The purpose of criminal laws is to punish individuals for their crimes and to deter and prevent further crimes. Characteristics of civil law include conduct that violates a person's rights, is detrimental to that individual, and involves an offense that is against an individual. The purpose of civil law is to make the aggrieved person whole again and restore them to where they were. All right. The nurse knows that litigation involving nurses is common because of which reasons? One, clients are better educated about the healthcare system or about healthcare, sorry. Two, clients are better informed about their rights. Three, clients do not trust nurses and primary healthcare providers. Four, clients have a higher expectation about the care they receive. And five, clients are aware that lawsuits result in payment of large sums of money. That's a good question. I like this question.
Three.
Okay, 3.
I'm gonna go with 5.
Everybody's like looking at this one's like, oh, I don't know. All right, let's just see. So it is 1, 2, and
The
4.
opposite.
So they are better educated about healthcare, they are better informed about their rights, and they have higher expectations about the care they receive. So reasons that healthcare related litigation involving nurses is common relate to clients being more educated, more aware of their rights, and having a higher expectation regarding the care they receive. Lawsuits involving nurses are not common because of an expectation of monetary gain or because nurses are not trusted. All
I feel
right.
like the way that question was worded was kind of.
I know it was kind of, yeah. I'm not sure I like the way it was worded
Yeah.
either. I didn't write it, so but yeah, I don't like the way it was worded at all. The nurse posted a comment on a social media site that was unflattering to another nurse. Which accusations can the second nurse bring against the first nurse? Select all that apply. So libel, assault, slander, defamation, and malpractice.
3, 4.
And their definition.
1.
Liable? Yeah, 1.
1.
So I say 1 and 4.
So 1 and 4.
Slander. Uh,
It is libel and it is defamation. You got to remember the difference between libel and slander, right? Libel is written, slander is spoken. I do it all the time. I always get them mixed up. So the first nurse could be accused of defamation, which is spoken or written statements made maliciously and intentionally that may injure the subject's reputation. And libel, which is malicious or untrue writing about another person that is brought to the attention of others. Assault is an intentional threat to cause bodily harm to another. Malpractice is the failure to meet a legal duty that causes harm to another. And slander is malicious, untrue spoken words about another person that are brought to the attention of others. I do it all the time. So I finally took me forever to get assault and battery down. But so remember, libel is written, slander is spoken. All right, the nurses decided to purchase disciplinary defense insurance and is aware that this type of insurance would provide which types of benefits. So this is like your malpractice insurance. So 1, representation by a qualified attorney. 2, payment to an individual for negligent care. 3, reimbursement for travel to the State Board of Nursing. 4, payment of all legal fees for defense of negligent care. And 5, payment of all legal fees for defense of a nursing license. So what do you think our malpractice insurance is going to cover?
Is it 1, 3, and 5?
All right, 1. You think they're going to pay for travel to the State Board of Nursing?
4 is it payment of all legal fees? No, you.
yeah, definitely 4.
Okay. So we got 1, 4, and 5. Anybody else have any other ones? No. All right. It is 1. Oh, it is 3. Who said 3 and 5? So let's see. So disciplinary defense. Oh, this is not. Okay. I've not ever heard of this, but okay. So I thought this was malpractice, but it's not. Disciplinary defense insurance provides benefit if the individual has action brought against a nursing license by a state board of nursing. The benefits of this insurance are to provide a qualified attorney to represent the nurse and to pay for or reimburse the nurse for this attorney. It will reimburse for loss of wages and also for travel, food, and lodging to a hearing at the State Board of Nursing. It does not pay legal fees for any monetary benefit to an individual if the nurse is involved in a lawsuit related to negligent care. Interesting. Have you guys heard of that before? I have not heard of that before. But whoever picked that one, that was good. I don't know who it was, but good job.
I did. I did it on the questions I did for you before.
Oh, okay. That was a good one. I had not, I just was, I didn't even like, I guess it didn't click disciplinary defense. Okay, that's a good one. All right. The nurse was assigned to care for 5 clients and spent most of the day caring for one of these clients who had just returned from surgery. The nurse did not ask for assistance and did not regularly check on the other clients. During the day, one of the nurse's other clients got out of bed without calling for assistance and fell, breaking an arm. Which possible charges could the nurse face in this situation? Select all that apply. So we have libel, battery, negligence, malpractice, and abandonment of care.
3 and 5.
Ooh, there.
3 and 5.
All right, 3 and
Negligence and abandonment.
all right. So, oh, and negligence as well. All right. So the nurse could be charged with malpractice, which is failure to meet a legal duty that resulted in harm to another. The nurse could also be charged with negligence, which is the commission of an act or the omission of an act that reasonably prudent nurse or prudent person would have performed in a similar situation, thus causing harm to another person. It is also possible that the nurse could be charged with abandonment of care, which is the wrongful termination of providing client care. These are some really good questions. All right, guys, awesome job. One other thing that I wanted to mention though, and it just dawned on me. When we are talking about religion and spirituality, so talked about praying with your patients, right? Sitting there praying with them, reading a verse out of their scripture or whatever it is. What if, okay, what if you're working in the emergency room and you have a client that comes in and has a major trauma or some other life threatening, imminent life threatening injury or whatever, and they ask you to baptize them. Can you baptize your client?
Yes.
Absolutely. So this is something that, if something happens, you absolutely can baptize your client. And doesn't matter if you're not the same religion, if you're whatever, it doesn't make a difference. And it's just a matter of taking some water and, drawing the sign of the cross on their forehead. It, can bring relief, right, to that client. So don't be afraid to do things like that. You can Google it. I know you can, there's probably a YouTube video that can help you with the process. But yes, so that is something else that I wanted to bring up. It's in the review for exam 1, but for some reason I thought it was on the slides, but it wasn't. So I figured I would just bring it up before we all left for the day. All right, guys, any questions? All right, so don't forget, next week is exam 1. Don't forget, please be on time. Make sure you have 2 devices, that you have a whiteboard and dry erase markers, that you have your ID. Trying to think of anything else. Nope, that's it. I think we got everything covered. I know you guys have taken in online exams before. if you want to proctor on campus, you need to give me 72 hours notice, as well as the name of the provider, or the name of the provider, the name of the person that will be proctoring you. So other than that, you guys have an awesome week, and I will see you next Friday. Be safe.
Thank you.
You're welcome.